Hello everyone. I want to personally welcome you to Advanced Pharmacology. My name is Susan Kinnear and I will be your facilitator for this course. Currently I'm a GI hepatology nurse practitioner in the city of Charleston, South Carolina. I've been in this role for about a year and a half. Prior to my relocation here in Charleston, I resided in Syracuse, New York, and I was an oncology nurse practitioner for probably about 13 years. Trained as a family nurse practitioner. Currently, here in Charleston, I also work as a mobile resource nurse for Roper Hospital. So I'm basically trained to work in all areas of the hospital. Currently, I do not do the ER. I do some ICUs, but I don't do the ER and I do not do the OR. And go to their 3 hospitals. They have about 700 beds. I grew up in Upper New York State, a foot across the Canadian border. And my nursing background, med-surg, quite a few years in critical care, interventional radiology. I have some OB experience, pediatric experience, home care, and behavioral health. I've always sort of had a second job and a lot of opportunities. And I've taught from entry level to graduate level and precepted nurses with their doctoral projects and studies. So nursing's been really a rewarding career for me. And I do appreciate and value the efforts of an adult learner because it wasn't that long ago I was in your seat. So I clearly understand the challenges in the multitasking and the sacrifices you have to make. Just don't get behind, because these courses, as you know, are very, very dense. I have 2 children, adult children. Kayla's a nurse. She lives in Beaufort, South Carolina. And I have a grandson that's turning 3 shortly here in South Carolina. So that was the main reason for my relocation. After I got in South Carolina, my son up in New York, Albany, New York, him and his wife had a baby, and he's going to be 1 soon. So I'll be traveling up there to visit. My interest, I love to travel. You'll see I'm sort of a curious type person, a little on the adventurous side, so I do love to travel. I teach many courses for Aspen. Some of you have been in my class. I teach advanced pharmacology, advanced pathophysiology, advanced physical assessment. Those are my core classes. I've also taught some of the other legal issues courses and other courses. So as far as feedback goes, I try, especially week 1, to get you feedback early so you can apply the recommendations to future weeks. As I teach multiple classes, I try after week 1 to rotate. Obviously, I can't get everybody their feedback back at the same time. It's quite a bit of reading, a lot of papers, a lot of discussions. I will be posting a tip sheet. I encourage everyone to read the tip sheet. It'll give you some tips on how to be successful in the course. I would also ask that you upload a profile photo if you do not have one. If you're not comfortable for any reason uploading your personal photo, please upload an alternate photo, something of interest. I want to, number 1, know that you can use the technology, and number 2, we are building community in our classrooms. If you have any question about that, I want you to personally contact me, okay? Most of you have a profile photo, but it is an expectation for my course. When you post, okay, in your replies, please respond to multiple topics other than your own. It shows me that you're engaged with the content. It's a red flag when week after week I have a student that only replies to the topic that they originally posted on. For example, in the GI unit, one of the topics is reflux, GERD. So you go on, you do your initial thread, and then you only reply to students with GERD. Tells me a lot about your effort, and it's a red flag. So please do not do it. With your references, please use peer-reviewed journal articles. I shouldn't be seeing anything from the internet unless it's a scientific site, like let's say the National Comprehensive Cancer Network, or some expert consensus site. American Heart Association, American Diabetes Association, National Kidney Foundation, peer-reviewed. Remember, you're moving to another level. You're graduate students. You're going to be clinical experts. You're no longer generalist. You're moving in a direction of specialization, whatever that means to you, whether it's education, forensics, whatever. If appropriate, and I'll give you some cues as we move along, please apply clinical practice guidelines when appropriate. For example, if we're discussing pain management, go and look at the clinical guidelines for pain management. And again, I'll be giving you some cues along the way. Turn it in. In my courses, students get very concerned about their Turnitin scores. These classes are very factual. It's very difficult to have a Turnitin score of 20 to 25%. It's rarely going to happen. I expect it. It's not a problem, okay? I don't want you to get all upset about that. So again, graduate students, evidence-based practice, your knowledge builders. In your reply, you have to, what I refer to as scaffold, add knowledge. That's the way you're going to get full credit. If you just put something out there as a reply to one of your classmates that's known information just for common conversation, you're not going to be receiving the credit that you would get if you build on the knowledge. A lot of students will say to me, assignment, I didn't understand the assignment. There's no real clear instructions or whatever. You're going to find that graduate school, and most of you have already probably found that graduate study is not as scripted as your undergraduate study. There's some room left there for your interpretation. If you're way off on assignment, don't be alarmed. I'll contact you. I'll let you know and give you a chance to modify the assignment within reason, okay? The best way to reach me is by email, susan.kinnear, my last name is like keep your kin near, at aspen.edu. Or you can call me, 315-560-9883. The issue with a cell phone is during the day where I work in the building, it does not work. So I have to leave my practice a few times a day and go out and check my phone. Sometimes I feel like I'd be better off with a couple of tin cans, but you have to work within your limitations, right? So email me, susan.kinnear@aspen.edu. I'll get back to you within 24 hours. If something ever happens and you ask me a question and I do not get back to you, do not feel bad about sending me a second email. I'm pretty good at, but I'm human too. And I don't want to miss any of you. I want to make sure that you have everything to be successful in the course. So I want you to have an awesome week. It's going to be a great 8 weeks. Again, I understand the challenges of adult learners. Just don't get behind. Don't procrastinate. I tend to be like the 11:59 girl. And I'll see you in the discussion room, and have a great course.